Hello, everyone, and very warm welcome to all joining us from over Pakistan, but also from other part of the world. And it's so wonderful to, I know there are a couple of the attendees here who attend every time. So today we are having another exciting APPNA Merit webinar session, which is titled as Pakistan Healthcare Landscape. Medical Women's Association of Pakistan driving change from Pakistan to the world stage. And I'm truly delighted, honored, and humbled to introduce our speaker, Dr. WAJIHA Rizwan. She's an inspiring pediatrician, educator, and advocate for the women and children right through her work. She also served as an associate professor of pediatric and deputy director of medical education at the University of Child Health Sciences, Children's Hospital Lahore, and also a visiting professor of pediatric at the University of Lahore. She is a founding president of Medical Women Association of Pakistan, which is called as MWAP, a platform that has opened doors for mentorship, leadership, and advocacy for women in medicine in Pakistan. Through MWAP, she has represented Pakistan at various global forums like UNICEF, WHO, UNHCR, and MWIA, making sure that Pakistan's voice is heard on key issues of child health, gender equity, and empowerment. She has over 30 research publications and several national recognitions, and she continues to inspire through her leadership, courage, and vision for a healthier, more equitable future. Before handing over to her, I will give some gentle reminders for everyone. Please be engaged. Keep your microphones on mute during the presentation, but continue to share your question, comments in the chat or Q&A button. And at the end of the session, after the everybody's comments, I will bring those questions for discussion. The session is being recorded, so it will be the recording will be shared with you to watch it later. And most importantly, let's keep this a very respectful, interactive, and encouraging space for learning and sharing. Thank you all for being here. Let's all give a warm welcome to Dr. WAJIHA Rizwan as she takes us through her journey of driving change in Pakistan and taking it to the world stage. Over to you, WAJIHA.
Just a minute. I think now you can
Yeah,
see
we
my
can
slide.
see your slides all good, and it's in a right format as well.
And thank you. First of all, I'm highly grateful to Apna, Dr. Jabeen, Dr. Akhtar, and Dr. Uzair, and Dr. Humara Kamar, and all the members of the Apna for having me here, and all the participants who have joined, because we feel truly honored that you have given us your valuable time. Now, just look at these two logos closely. What is the bond between these two logos or these two associations? I would like you people to write in the comments. What is the bond between these two logos or two associations, Medical Women Association of Pakistan and APPNA MERIT? It's not just the medicine, it's the spirit of Pakistan, the pride that binds APPNA and MWAP. From home to the world stage, we carry the same flag, the same fire. That's Pakistan. I'm Dr. WAJIHA Rizwan, the founding president of Medical Women Association of Pakistan, and I am also an associate professor and deputy director, Medical Education Department at University of Child Health Sciences, Children's Hospital Lahore. That is the largest pediatric unit in Pakistan and second largest in Central Asia. That adds to my confidence when I talk over a global platform because I come from a place that is considered to be center of excellence in Pakistan. Today, we are going to talk about the Pakistan healthcare landscape and Medical Women Association of Pakistan driving change from Pakistan to the global stage. Undoubtedly, the APNA physicians are leading globally and bringing immense pride to our nation. Today, we are excited to share the story of a powerful movement that has begun in Pakistan, one where women have joined hands and men stand beside them as our alliance. Project a positive image of our country. This is a movement that shifts the narrative from seeking donations to driving innovation inspired by our own indigenous wisdom. And we are glad that this webinar might open doors to future research and academic collaborations between APPNA and MWAP. And this is the overview of my presentation. It's not some talk, it's just where we are excited to share our success story with our members of APNA who are already bringing immense pride to the country. We would be sharing vision and mission of Medical Women Association of Pakistan, our milestones, our future goals and roadmaps, our messages and input from various directors. When we started talking about Medical Women Association of Pakistan, a question came up. And the question was, isn't the white coat supposed to make us equal? So why MWAP? So we always considered, people were curious that why we are talking about another association in Pakistan when already many are existing. So we all know that the current situation in Pakistan is that there are 70 to 80% Pakistan medical institution students are women. This is the situation of the medical colleges. And let me share another picture. Other fact that half of these female do not continue medicine and 85,000 female doctors in Pakistan are not working. So where are they going? Where is that passion going? Now, this is the picture of a conference of vice chancellors and MS led by health secretary. And how many women you could see in this picture? The other picture where 70% are women, and the other picture where we couldn't hardly see any women. So where the gap lies, what is happening in between? They are entering the medical college as toppers and they vanish away when it comes to the leadership. So we believe women didn't come this far in medicine to remain invisible in leadership. Now these are the two buses. I would again like if you people can write in the chat box, what is the difference between these two bus? If you any one of you can write in the chat box that what is the major difference between these two. Yes, female representation is more. Where the female representation, genders of drivers, segregation, gender of drivers, segregation, wonderful Dr. Ozair, another perspective. So what happens now? This is the first bus that is being driven by a man and the second bus that is driven by a female. So this was happening. Am I audible?
Yes, Vajia, you are audible.
Yes, yeah, yes.
I can't take my screen now. I'm unable to move it. I don't know
So,
what happened.
Yeah,
Hmm?
you can click the screen and try it again. Otherwise, unshare and share it again.
Yes, I think now it's working. So
Perfect.
this
yes.
is the first picture where it's a it's a leading association of Pakistan, the bus driven by males, and this is the International Women Day. How many women could you see on the stage? And this is the other one, though we also had Javed Akram Saab. This is the difference. Why we are talking about this difference? Like Dr. Uzair said that there's gender segregation. We truly do not believe that in leadership there should be any gender segregation. It's a bitter truth that when in a full room of men, women would be reluctant to come forward. They would be more comfortable when and there are more women. They feel uplifted by each other's presence. So in Pakistan, and we felt that we are not being offered chair, so we created our own table. And on this table, we welcome everybody to bring their chair, no matter man or woman. This is our association, our vision mission. Mainly, we say that no decision about women without women. We don't say that we want to take all the decision ourselves. We believe that we are born to complete, not compete. We have our own unique qualities like men have. So we need to sit together on the table to collaborate rather than competing and working in different directions. This is a hybrid launch of MWAP, Medical Women Association of Pakistan. Tomorrow is our anniversary, and we would be celebrating it on 27th. My special thank to when we started talking about MWAP, resistance came that they are talking about something that doesn't exist. You all know that it is very easily accepted in Pakistan if there is a Gora or a global validation to that idea. So when we searched, there was Medical Women International Association. That is an association where all the national associations of different countries, 70 countries, collaborate. It is working since 1919 and is registered in Switzerland, Geneva. We started writing to them, and they gave us ultimately Pakistan chapter on 26th October. I'm highly grateful to Dr. Nawadinobi, who is from Nigeria and was the president of MWI, then Dr. Daroni, who was the vice president of Central Asian region, and she's from Thailand, and then Beverly, who is from Canada and was also the president of Canadian Women Federation. We approached her via Facebook, and she linked us to the leadership of the MWIA. This is our vision. We want to create a health community that helps women health professions thrive as leader and they could act as positive agents of change. We are working towards gender inclusion, diversity, and excellence. We want women to exceed in all fields. These are our goals. We are working to promote gender equity, advocacy, professional development, community engagement, mentorship and sport, research, innovation, and public goals. And these all marvelous ladies are head of institutes in their own institutes. They are accomplished women. They didn't need any association for their own growth. When we talk about the change in community, it is not possible when we work in isolation. So these all legends from the medical field have joined hands to uplift others. These are our values. We believe in equity, empowerment, collaboration, professionalism, and advocacy. And we are now registered in Pakistan. Many people say that why we are working very slowly, because we didn't want to remain a Pakistan chapter of Medical Women International Association, because then we have to follow their agenda. So we also separately registered in Pakistan as an NGO that is registered through SCCP in Islamabad, Medical Women Foundation of Pakistan, where we would be working on broader aspects, not only for the women health professional, but building communities and specifically being the advocate of research and innovation in Pakistan. I'm the founding president. Then we have Senior Vice President, Professor Shamsa Hamayu, Professor Mavish Arooj, who is the principal of University of Lahore. Then we have Vice Presidents, Professor Lubna Kamani from Sindh and Karachi, and a renowned gastroenterologist. Professor Bilkis Shabir, who is from Fatma Jana Medical University. Professor Nabila Talat, who is Registrar, University of Child Health Sciences. Secretary General Hatija, that is at present at UK. Treasurer Dr. Rabia Wajid, she is gynecologist at Kid Edward Medical College. We are very lucky that we have the best people from different provinces. Professor Halima Yasmin, who is a very credible gynecologist and a medical educationist. He leads Sindh as the director Sindh. Then from Professor Sindh, KPK, Professor Salma Kundi, who is also past president of Pakistan Medical Association. Today was her daughter's Walima in Lahore that I missed because I committed to the APPNA. So many of our members haven't been able to join online because they are attending the marriage ceremony of her daughter. Then we have Professor Aisha Sajid, who is professor and she's leading as Director Punjab. From Gilgit, we have Dr. Saima Kiran. Research, when it came to research, they were brilliant ladies and researchers, but we chose the best person, Professor Nazir Shimran, who is among the top 2% researchers in the list that was declared by the Stanford. Then we have Professor Sara Afsal as a Director, Students Affairs, who is Dean IPH, Director, Counseling Cell, Dr. Aisha Sahir, the toughest job She is doing Director CPD, Professor Saima Batul, and Director Technology and Innovation, Dr. Noore Kiran, Director Foreign Affairs, Dr. Lubna Riaz. And in advisory board, we have Chairperson Professor Saima Chaudhary, Professor Sabah Suhail, who is the principal of Dow Medical College, Professor Sumaira, who is the Director DME of University of Health Sciences, Professor Taiba Wasim, who is principal of Allama Iqbal Medical College, Professor Lubna Ansari, who is now working at University of Lahore and the first medical educationist of Pakistan, Professor Aisha Humayun, who is also serving as principal of Sheikh Zayed Medical College, and Sabah Salim, who is the public health expert. Dr. Saima Batul is the director, continuous professional development. We have various webinars from specifically, we are also having webinars with the facilitators across the border. Specifically, we were very positively engaging with India before the Mahka-e-Haq. These are the seminar and workshops which are being conducted in different provinces. We not only highlight on the women health, but especially also on the child health. Female cancers, workplace harassment, healthy aging, leadership, parenting, ethical profession, and research are our main areas of interest. And this was these are again a few collaborations with the family physicians, with the Salco Chamber of Commerce and University of Child Health Sciences. This is a very different project that we have started. It's MWAP Power Talk, where we invite leading women across the globe from the Pakistan who have overcame their challenges. They come and share their stories. And interestingly, two of the most impactful leaders were, one was Dr. Humaira Kamar, our first participant whom we chose as the speaker, was the APPNA president. Then we had Mariam Chugtai, then Dr. Rafia Kutub. And we plan to publish, when we have the 12 stories, then Medical Women Association of Pakistan will publish this as a book that would be inspiring for all the young women who are striving to be the leaders. We are very active when it comes to the gender-based violence. These are the different seminars in different universities. We are also working in collaboration with Women in Global in Health and MWIA. This is very interesting. Through the Medical Women International Association, it has got the consultancy status of WHO and UN. So we got a call for submission of report of discriminatory practices against women in Pakistan. And this was sent to the United Nations on the women right. And we reported the honor killing from Pakistan and asked for UN support to label it cold-blooded murders. This is the letter which we have sent to the communication to Commission on the State of Women, where we reported the case of Bano Bibi and Sidra Niazi. Sidra Niazi was a girl who became doctor, and then she refused to marry her cousin and was shot dead by her father. We also celebrate National Health Heroes. Why we celebrate National Health Heroes? Because though we say that validation is not required, but even Allah likes to be acknowledged. So we decided that we should celebrate our women, because many times we hardly see women as leaders. So we wanted to celebrate those who could inspire the young girls. We have been celebrating Women's Day from last 2 years. First Lifetime Achievement Award was given to Madam Atiya Mubarak, and second was to Professor Shakila Zaman. And then we have impactful leaders, one from a foreign faculty who have been serving Pakistan in different ways. This time we honored the major lady leading the Islamic First Aid. And then we celebrated also the International Nursing Day, where we acknowledged as the recipient of Lifetime Achievement Award and impactful leaders from various provinces, the nurses who have created some difference in their own field. Um, uh, One question comes that was also in the beginning, that if we talk about Medical Women Association of Pakistan, we are talking about women. We certainly, when we talk about gender equity, we can't just talk about women, women, and women. So we love to celebrate men. We have started celebrating Men's Day in Pakistan. Our champion of change, we declared him the champion of change, who has played a positive role towards the gender equity. And when it came to the first person, no one other better person could have been than Dr. Javed Akram. This is what we believe. Woman doesn't need to be given power. She was born with it. What we need are men who don't fear that force but fuel it. And I would say that in APPNA, I came across two such men that include Dr. Uzair and Dr. Akhtar. The way they were encouraging Dr. Jabin. So, sir, we truly need men like you to come forward to help us because we have our limitation. If you would say that if you have a limitation, sit home, then 50% of your population won't be working. So we do require little support, and we are highly grateful to the men who are willing to lend that support. From Medical Women Association of Pakistan, we have started offering some scholarship. This is the academic governors course that we recently offered. Its fees was 80,000 that Medical Women Association of Pakistan has paid, and Dr. Nabia Frasad, who is from Balochistan, won this scholarship. And again, I'm highly grateful to Education Unlimited, who is supporting us in this regard, and the CEO, Dr. Munib. This is a meet and greet. This is a very different sort of a meet and greet that we arranged here. And in this meet and greet, women from various sectors, not only health professionals, from politics, from MPs, MNAs, from bureaucrats to the chamber representative and media person, joined over a cup of coffee, and we have opened the doors for the multi-sectoral collaboration between the women, because unfortunately in our society still it is not seen in a good manner when women hang with men. So we have formed a coffee table where all the women join hands. Then this is University of Child Health Sciences, my parent institutes. We are into some sort of donation. We are working in collaboration with Islamic First Aid. We have been helping them in establishing their simulation centers. We have also managed prayer areas within the ward because most of the attendants are mother in the government hospitals, and we do not have any respectable place where they could offer namaz. So we have on the our own donation basis, we have arranged such prayer areas in the Children Hospital Lahore for the mothers of children. So it's not only about empowering women health professional, but women and children. These are international linkages. When the Indian doctor was brutally murdered in the hospital, we stood beside India and we said this resolution to UN that women health professionals must be provided security within the hospitals. India and Medical Women, India on the platform of Medical Women Association, International Association, still holds a very positive bond with Pakistan, and we are also having a very professional relation with Medical China Medical Women Association. This is the UNHCR Medical Women International Association gave Pakistan chance to lead through an inclusion vaccine coverage and Pehchan last month, I think so, that Dr. Naeem gave the presentation. So we presented his concept of maternal and child health center of Khushhal Handar at UNHCR, and it was widely appreciated because in this we think about working on improving health in a holistic manner. This is the MWAP survey. This is the roadmap. We conducted a study understanding barriers and enablers for women in medical health professional, comparison of male and female perspective. And this is the roadmap we have created, and it is under publication as a research article that we believe that women need mentorship and leadership programs to excel or to retain them in the medical field. They must be provided a women-friendly workplace environment like daycare centers. We should encourage in-laws and spouse to help women continue their career. They need counseling services regarding work-life balance, equal opportunities in promotion, and supporting group and networks like that of MWAP help them grow. So these are the areas then on which we have started working. We have arranged leadership program and courses. We have launched a research course. We have been advocating for post-fellowship observership, specifically designed for females, because many times it is not practical for them to do a 2 or 4 year fellowship after one fellowship. So we have been requesting that we should launch some observership specifically where they can work abroad for 1 month and gain an international experience as well. We also arrange policy dialogues over gender disparity when Pakistan stood last in gender parity index. Are being the advocates of the women professional health right. We are proud to be the National Association of Medical Women of Pakistan. You can't imagine the moment when you are asked to lead your country holding your flag. This is a moment of pride.
Islamic Republic of Pakistan.
So you can understand how much happy we feel and excited we feel to play Dil Dil Pakistan on a global stage and make even India shake legs with us. This is the time we represented Pakistan at Thailand, and we are with the ambassador of Pakistan to the Thailand. And this is now recently on 11th to 14th October, we represented Pakistan at Egypt and Cairo. And this was my talk that we dedicated to the martyrs of Husdar, the girls who lost their life in bomb blast. And organizing Secretary of Child Protection Unit at my hospital that is the largest one in Pakistan and second largest pediatric setup in Central Asia. And now I dedicate this presentation to the schoolgirls who lost their lives in May 2025 when a school bus was bombed. We owe every child a safer tomorrow. Disclaimer, terrorism has no religion or ethnicity. It is born out of hatred and can only be defeated through love and peace. I just shared this video because in our little capacity, we are trying to change the narrative of the world that Pakistan is a very is a country that doesn't let its women lead. When we went to the attend this Congress, trust me that we were so confident compared to the Indian women health professional because we felt that we are truly free to say anything compared to them. They were even reluctant to take the pictures with us and the Pakistani flag. Now, just I would be ending my presentation with these last few slides and my tribute to this lady who agreed to be the director research. She is traveling from US, so couldn't attend this webinar. She recently got a scholarship from American Psychiatry Association for the Adolescent and Child Health. We are working and we have started producing an impact research that is being published in impactful journals. We have the published research includes breaking the silence, exploring the workplace experiences of healthcare workers and burnout and moral injury among women health doctors in Pakistan. We have coined a new term, gender professionalism. I would like to some other day share about that. And we also advocated for Sharia compliant wet nurses system, culturally sensitive alternative to human milk bank. And this was a special edition that was dedicated to the women leadership, bridging the gender gap in health challenges and solutions. We are collaborating on different research conferences. This was held in Ahmedabad Women Medical College, and the other one was held in University of Faisalabad. This is the medical synopsis writing course launched by MWAP, where we have registered 10 postgraduate residents because unfortunately in Pakistan, there was a culture of fake research. PGRs were giving 25K or so to the people and they were writing the synopsis for them. So we started this course and we would love if any of the member of the APPNA wants to join us as a facilitator. It would be truly an honor and would add to the impact of this course. This is the Medical Women International Association, and this is the QR code that you can scan to see the work that we have done as a Pakistan chapter of Medical Women International Association till now. I would end my presentation by saying MWAP isn't a sport group, it's a movement. Join us. We hope for academic and research collaboration with APPNA MERIT. we want that there should be collaborative research like you people are already doing with various universities. We have patience, we have evidence, we need your expertise to help us in writing or specifically grant writing, or we should sit together to work over the methodology that should be practically be possible in Pakistan. We assure you that our you know that at present the chief editors of almost all the Pakistan medical journals are women, and most of them are part of Medical Women Association of Pakistan. We are pretty much sure that all your articles would be of quality, and they would be we would go through the fast publication in our journals that are led by our women chief editors. We wish to have collaboration over CME and sport. We need your support in networking and extending scholarship from our sides to yours and from your sides to especially to the women in Pakistan, and help us find opportunities where females from Pakistan can go abroad and do the observerships of 1 or 2 months so that we convert brain drain into brain gain. Thank you for listening. House is open for discussion. Thank you once again, Dr. Jabeen, Dr. Zaid, Dr. Akhtar, and Apna.
Thank you so much, Wajiha, for such a broad summary. And yes, I forgot to mention about my panelists, Dr. Uzair and Dr. Akhtar Hamid. They are all, both of them are here, and I will open it up and maybe ask them to share their thoughts, share their reflection after your presentation, Vajia, and then we will go to Q&A. So, Sarozar, please go ahead.
Uh, Thank you very much, Dr. Vajia. What a great story. Now, in these days in management, they say the most effective communication is by telling story, and which, if it's a true story, no match really. It's more absorbing, and it's a great interest, I must say that. So it's a journey, and we really appreciate, respect, and congratulate you to your journey. Phenomenal, and it's a very heart touching story. If you decide to start something, the chances are you will get it. So the journey start. So just I we would like to know more. So that's the journey. Beautiful, nice. What was the real challenge in order of their impact on your journey, and what was the real step you had to take in terms of strategies to overcome those challenges? Because that will give knowledge to all the participants. Where there is a will, there is a way. So, what are the challenges, how to prioritize, and how to strategize to achieve and cross them? So, just one by one, whatever you have faced based on your own experience as a professional, as a leader, as a professor, educationist, and a medical doctor. So, challenge, they may have different roles. Gender is just one thing, but how the gender is being maneuvered and manipulated. So we would like to know from your side what is the real story behind that. Please go ahead.
Sir, I always think and I always say being woman is a strength, it's not weakness. You need to have self confidence, you need to have your credibility. If you are a credible woman, whole world listens to you. It's far easier to be visible if you are a woman compared to man. But the there you should have the courage and ability to lead and pay the price that comes with success. Um, uh, what we wanted, this is not what we wanted to be a Pakistan chapter of Medical Women International Association only. We wanted to have a global platform where we change the narrative. Pakistan isn't that backward country, it's progressive. They don't like me much because I never cry. I never ask for the donation. I never have self pity. I say that Pakistanis are self sufficient. We are the nation that leads globe in philanthropy. I always say that maybe we are a poor country, but of rich people. You can't imagine the lifestyle of ours. We don't need any outsider to help us. We have people who are representing Pakistan across the globe, like the associations of UK and Australia. We really do not need any foreign association or organization to help our. We are self-sufficient. We wanted to portray a positive image of Pakistan, like the narrative that beggars are not choosers. You can all relate to me that it hurts, and we wanted to change that narrative, but we wanted women to lead, women to come forward. Because unfortunately, when only men are seen leading, they say that we are very helpful or supportive toward women. World won't believe. When we represented Pakistan at Global Congress in Egypt, they were very surprised to see. Indians asked that when we go back home, they ask us that these are the females who take whale, and they asked us that how you are surviving in Pakistan. We are not surviving, we are enjoying in Pakistan, was our narrative. So one of the major thing that was that we wanted to improve the image of Pakistan globally, that alhamdulillah we are doing. Secondly, it's all about how well connected you are. We can't deny this. Even if you go to a hospital, specifically in Pakistan, if you have contacts, you don't have to wait in the list. Similarly, the major offices are being occupied by men in Pakistan at this time. And being a woman, we are reluctant to take favors from them. So we wanted that more and more women in the leadership should join. We should make them own each other. So when they are seen standing together, it is more difficult for others to harass them. Young girls should approach us. If we say that, if we talk about your daughter, you would like to, you would like that she go for a help to a female or a male, you would be more comfortable that she takes help from the female. So men are also more and more believing us. I love this idea when fathers call me and they say that we want our daughter or our sister to be part of your organization. And this is what I all want to say.
Great. So this is a really a pride moment. So now move on to some more professional comment. Dr. Akhtar, would you like to say something about this journey and Dr. Wajiha's initiative? Over to you.
Thank you, Dr. Uzair. I totally agree with you in terms of the story she has told about her journey and her success. As she rightly mentioned, working the cultures like we have in Pakistan, to go to the leadership position is difficult. I mean, we have another example, Dr. Jabeen. She has been also working through that, and she has also, and now you can see that she has acquired a lot of leadership position even in internationally. So, and she is not only working alone, but also she is. I'm talking about Dr. Jia. She's also getting full collaboration and trying to get the organization who can do such things. Now, my question to her is, how can she make sure that the generation behind her will be able to walk on her footsteps or footprint, in terms of taking the challenges of women education, because she's also educationist. So how she can, make sure that she, or what are the steps she has taken, or initiatives she has taken which can help to support this idea?
First of all, I could see a few comments that there have been women leaders, and many women have been the principal or so. Whenever we talk, we don't talk about a single example. We talk about the evidence. And what we are saying is evidence-based. In previous, till 2021, there were studies that only 10% institutes are headed by women. So whenever we talk, we should talk about the evidence. Again, I would say that we are not at all anti-men. Men are supportive. They support us. But then you have to pay the cost of leadership. Like Jabeen, she is one day in North America, and now she would be in Islamabad. It is not easy for the woman. Many times in-laws are not supportive. It's not only, we have a patriarchal society. We have defined our gender roles where women have to mainly take care of home. I always believe that if taking care of children give you peace of mind, then you shouldn't be worried that you need to be a HOD of an institute to be labeled a successful woman. A mother who has raised kids very well, she's also successful in her own way. Cooking a meal for your kid gives you happiness. You shouldn't be worried that someone else is leading like a professor. So first of all, it is not at all that we think that women are very being suppressed or so. We are very positive. What initiatives we have taken working on the when we knew that we preferred quality over quantity. First of all, it was most important to choose the women from all over Pakistan and around the globe who could be the face of Pakistan. So mostly the women we chose, and those were the founding members of Pakistan, they are the head of institutes. They have their own institutes. That's why we don't need donations to run our activities because they are leading institutes. So we are easily having our penetration in different provinces. So I will say that it is success in such a short time because of 33 founding members who are accomplished women. And real challenge was finding such women who would be serving this association selflessly. You know that all the women who are the founding members, they are much more senior than me. They have much more accomplishments than even I am the founding president. It's very difficult to let a young face be the leader or the face of an association that these incredible women have done. And this is the change we have brought.
Thank you, Dr. WAJIHA, to explain it so well. Um, there are some the challenges of workplace harassments, and somebody was commenting, Ahmed Badr was commenting that mixing the workplace harassment and laws abuse with leadership. So how would you respond to this statement?
Workplace harassment and what?
Why what Mr. Ahmed is saying, aren't you mixing workplace harassment and in-laws abuse? So how are you going to respond to this?
No, we are not mixing the workplace harassment with in-laws abuse.
With
Workplace
leadership.
with leadership. These are two different things. That was a survey that we conducted why women don't continue medical profession, they leave the medical profession. And the second, that is an article that is being published that says that why they leave. The major answer was that they don't have supportive families or in-laws, and why they don't get into the leadership position. In that, workplace harassment plays an important role. Now ask me how. Now let me give you an example. One of the female wanted to be the president of an association, of a gynae association, and a male was competing her. And then he made her call to different ways that you should retract your nomination, else you would suffer the direct assassination. We would be taking your husband on board. And then she silently stepped back. Many women they feel that because women lack networking, they are harassed. You would be surprised, they are even harassed if she decide to have one party chief guest and the other party would say you would be bearing the consequences. These are the real stories. They are afraid to even share. So when I would say I am a successful lady and I will tell that I am being harassed, nobody would believe me. So it is the job of the association to come forward and talk about the rights of the woman in the leadership. Being principal, even you are being harassed, you have to step back. Many times you have to step back in a way that you are people are saying that women are principal. How many VCs in Punjab are females, by the way, at present? So as the main leadership went to the VCs, so they are being seen as dean and principal, but none is vice chancellor. But hopefully this will have a shifting paradigm, and in next 10 years you would see more and more women in leadership as VCs or as principal, only because of men who are here. Problem is that when we criticize, actually all the men who have joined this webinar, I truly believe that they are the supporters of the women empowerment. And this is not what we are talking about you, because you are good men, you have a good mentality. So you can't even imagine how workplace harassment female face. They are the professors who ask their associate professors who are divorced to have a second marriage, but they say that we are not going to, we don't want to disclose it. We would give you money, but we won't be giving you name. These are the bitter realities. And when they refuse, they spoil their ACRs. And these are the cases that have been reported to health department, and actions were not being taken. Then we intervened, we requested, and the female got justice.
Thank you, Wajiha. I would say, I would summarize it like, yes, there are every community, every society have different ways of dealing with the leadership issues. And it's not only the issue of societies like Pakistan, but it is equal an issue for any North American society, I would say. So I would say that what these association will do, and I am reading a lot of comments, and I completely agree what is being said. Women are always have been in leadership. There's no second guess about it. Like my supervisor was DS Akram, who was the head of the department, and who know Pete's. Everybody know how strong a leader and a lady was, and how much she has done for child nutrition. Then Femina Arif, Aisha Mehnaz. You can start naming them, and then the names will go on. In my opinion, if I look at these kind of forums, they provide a safer, braver, and supportive spaces where not only those experiences can be heard, but then solutions can be provided to the society where the work, like, because we all, like, so in a society, men, women, all work collegially. It's just bring that collegiality to be on the surface, not only to see the darker side, but also the brighter side, and to provide an opportunity where there are opportunities to improve, and then show at the international forum, as Wajiha has been presenting, that the it is brighter than what many people in the whole world think. Our Pakistan has a very brighter side of it, which internationally people are not able to see. So I think this is the biggest achievement that MWAP has. And I would like to tell you, Wajiha, there are many people who are praising the work you have done. Dr. Rafiq is congratulating. He is in a flight, but he still attended. And then he's mentioning Dr. Azra, you might know that she's a project director for Autism Without Borders, and she want to congratulate you on behalf of Infection Control Society Pakistan. There are many other very, very great comments. If you read through, please provide your email address so those who are interested can be able to join, like to connect with you and to propose some solutions or some collaboration opportunities. So I would say organizations like MWAP are not about either separation or demarcation. They are about connection, mentorship, and lifting others up. And that other part can be anyone. And as Vajiha very well mentioned, that we are not only the maker of personal self, but also families, and those families will turn into societies, and those societies will represent a country. So this is kind of my reflection, Vajia, hearing everything. And I would say, rather seeing such a platform as divisive, I invite us all to see it as a catalyst for collaboration, for equity, and collective progress. So these are some of my reflections.
Exactly.
Excellent. So the last comment from my side
Hmm.
to Dr. Vajia, you took a very, very brave step to take your message to multi-sectorial level. So I
Hmm.
still vividly remember there were female parliamentarian here and there. They did not have super leadership because they were coming on these special seats, so they could not unite their voice. So if you get them involved. Trust me, you will get great support from some big change, like the political change, like you mentioned about the vice chancellor's position, and many more roles. So those are young generally. They are sensitized. They are exposed to the leadership position in the parliament, and they can take your voices. So my suggestion to you would be, please do involve them. What they are missing is the confidence and the leadership. The reason is that you see them in the parliament, the number is not less, I tell you this thing. If you consider with any other country like Pakistan, so this is not comparable, this is little better percentage, I must say that, which happened during last regime. So just approach them, and multi-sectorial approach will give you a lot of leverage. Now, like the first justice in the Supreme Court, Aisha, she can be of a great sport. So these types of people, they can bring a lot of influence, leadership, change, and help in the decision making, so that we can really feel about it. And I know, like this, the lady I just mentioned, the justice, she is very learned, trained, educated from North America, very visionary. Really, if you approach, I'm sure she will be very forthcoming to help and associate with you. In the same way, in the parliament, you will find a great support. So these are two things generally, because particularly when we are at the provincial level, we overlook them. But these are some opportunities to network, and this is going to strengthen your voice in a best way.
Hmm.
So we congratulate you once again for your great initiative, and I also appreciate the patience and the very strong participation from all the participants. So I request Dr. Jabin to formally thank Dr. Vajia, and then we thank everybody, and then we can leave. Over to
Dr.
you,
Jabin,
Yes.
Doctor.
Dr.
Yeah.
Jabin, I would like to answer Dr. Said that. Sir, we are
Hmm.
in contact with women parliamentarians. The meet and greet was attended by the Sara Ahmed, the Minister over the Child Rights, even the Parliamentary Secretary of Specialized Health Department. I have been invited to the Women Caucus, and I would be presenting the idea of the gender professionalism there. We have been invited by the Education Minister, and we are coining a term of gender professionalism where we want this to be integrated in the curriculum. We are also trying to have Asafa Bhutto Sahiba as a chief guest on this Women's Day. On the other hand, we are also in contact with the Chief Minister Office, Mariam Nawaz Sahiba, through her special assistant. I was in a 14th August special transmission with the a youth representative of the PM, and he was very much interested. He wanted to convert brain drain into brain gain. He wanted to reach you people out who are working at different countries at the influential positions. They were saying that in India, people working abroad facilitate people from their own country, and they wanted that we want to reach out people who are working in different countries. So I always believe that when we should never think about our own political liking or disliking, because who is at the seat of the country prime minister, if they are bringing some change that could help improve the image of the Pakistan, we must join hands. And we would be requesting Dr. Jabin, if any one of you would be interested, we would like to connect them directly to the youth representative of Prime Minister of Pakistan. So we are all working on all these aspects. I would just like to end by saying this: if Medical Women Association of Pakistan was founded by accomplished women, that it includes 8 to 9 head of institutes who are serving principal. So there is some problem. We need to accept this, that women lead to collaborate, women lead such platforms to lead even more effectively. Thank you.
So just few words with apology and with permission from Dr. Jabin. There is an initiative from Canada. Vanessa, she's the president of the university. Her journey is very interesting. She was trained and educated as a nurse, and she rose to the position of president of the Algonquin University. And they have a big initiative, and they are doing. They had a meeting like 3, 4 times to Pakistan, but they visited Karachi so far. And they are backed by a lot of parliamentarians from Canada, and it's a strong move. That is the women empowerment, and I will share with you the detail on your email. And they are very forthcoming. They are very receptive, and they can engage the other group of the medical side. I mean the nurses and all those things, and they are being supported by Canada Pakistan Business Council. I'll share with you the detail. So with this, over to Dr. Jabin for formal closure. Thank you.
Yeah, thank you so much, Dr. Azair. There are a lot of people who want to connect. I have shared the email. I know, Vajia, you also shared the email. And there is a huge opportunity that once we strengthen, we can focus on areas and focus on women where things cannot be reached. And by saying things is education, health, opportunities, because we got this opportunity and we avail that. But there are many, many people, and I would say women in the rural areas, which even do not get this opportunity. So how can we strengthen ourselves and bring these opportunities to them? And definitely it will not happen with a wink of eye. It is a slow, steady process. It has just started, and I'm seeing comments that what will happen to the rural areas women, definitely something will comes up, and it's not the responsibility of this society only. It is the responsibility of each and every person living in Pakistan to make the conditions, to make the opportunities available for every one of us. With this, I will close it up, and thank you, Wajiha, for your presentation and for sharing a story with us. Bye bye. Assalamu
Thank
alaikum.
you.
Take
Really
care.
honored.
Allah
Allah
Hafiz.
Hafiz. Allah
Allah
Hafiz.
Hafiz.